Hi and a very warm welcome from me, Phil Parker, the designer of the Lightning Process, and Jacqui Aston. Say hi, Jacqui.
Hi.
Welcome to this edition of Lightning Process London podcasts, where we aim to answer some of the most frequently asked questions that people ask us about the Lightning Process. We've done a couple. I did one with you, Jacqui, a few weeks ago. Did another one with Helen yesterday, covering a whole range of stuff. And today, one of the questions that we often get asked is the thorny issue about money. So we're going to talk about why the Lightning Process costs money, and we're also going to talk a little bit, which is linked to it, about practitioner training, what that is, what people have to go through, and what, a bit more about practitioners in general. So where do we begin? Money. So why, Jacqui, do you charge poor people who are ill to take the Lightning Process? Now that seems like a tough question, because there's this assumption that if you're ill, then why should you pay to get well? And I can understand that perspective, because everybody deserves to get well. But what's your answer?
Yeah, that's a very good question, and also a relevant question. I think one thing to look at is within the UK, we're used to going along to our GP, getting referred, having surgery, getting all kinds of treatment for free, so to speak. But in fact, it's not free, because we're paying taxes and it costs a lot of money, all that treatment. And I think that when I've worked in other countries where they don't have a health service, they are more open to paying for other treatments, because they're used to having to pay for everything. And I think that when I look at what I pay personally on recovering from ME chronic fatigue, my average was about £2,000 a month that I was spending on specialist nutrition, whether it's Chinese medicine, whether it's acupuncture, whether it's various different supplements that cost a lot of money, seeing specialists. So from my perspective, the price of the Lightning Process wasn't very high, but also I can see it from the other side, that if you're not used to paying for treatment, it can seem like a lot of money. But one thing I say is, when it works, it's very, very, very cheap, or it's hardly worth anything. If it doesn't work, it could seem like it would be a lot of money. So I think that's one of the considerations, is people are not sure if it's going to work. So they're like, why would I spend all that money if I don't know if it's going to work? Or I don't have that money because I'm not well and I can't work, and I'm in a situation where, in the UK, a lot of people who are unwell are probably on benefits and they don't have that kind of money. So why should they pay for it? And I think one thing that's worth mentioning is how hard we've worked as an organisation, especially Phil and Fiona, who's head of research, at getting this to ultimately be available on the NHS, which would be wonderful, because then people wouldn't have to pay. But that takes a long time, and that takes a lot of work on everyone's part to allow that to happen. I don't know if you want to say a little bit more about that, or...
Yeah, I think there's lots to talk about on this. I originally trained as an osteopath, and pretty much all osteopathy is still in private health. There are some osteopaths on the NHS, but fundamentally, if you want osteopathy, you have to pay for it, and it's tough. But the reason behind that is, and the same for Lightning Process practitioners, acupuncturists and nutritionists, if people don't get paid, then they can't work because they can't eat and they can't afford. So if you're an acupuncturist and you have to have a proper job in the daytime in order to do your acupuncture, because nobody pays you, because everyone should get free healthcare, then you're never going to get very good, because you're going to be knackered at the end of the day of doing a proper job. And then how many clients are you going to see, and how many clients can you see a week? So if you are a professional, you need to spend an appropriate amount of time training, practicing, doing continual professional development, and that has to be funded somewhere. I was talking to somebody the other day about this, about charities. That even in charities, they have to have a website, a legal department, a CEO. They have to promote, they have to collect. They have to have accountants. Those things just have to happen, and unfortunately, some of every charity or charitable donation goes into managing that. But if you don't do that, you can't have the charity. So that is just the way that it is. And as you say, we are working towards having this part of the NHS, but that is a massively long haul. It's taken us a lot of time to get where we are, where people in the NHS are starting to look at what we're doing, starting to consider research. But it's still years away. And the only other option is to charge for it or not charge for it. If we don't charge for it, we can't do it. It's just not possible to maintain a career in doing this, to be professional at it, to be available, to be trained. It's just not possible. So we're kind of stuck between a rock and a hard place. We would love to give the lightning presses away for free, but there's no mechanism. In the same way as, if you go to the doctor, the GP consultation is free. The antibiotics are pretty much free. You have to pay for a prescription, but it's relatively free. And the only reason it's relatively free is because it's not free, in that there is a massive amount of money going in to making it relatively free at the point of your contact with it, which is fantastic. And the NHS is an amazing thing. But the NHS only provides this much of what's available in healthcare. It doesn't provide all the other stuff. And it has a measure of whether something is allowed in or not, called the NICE guidelines. And the NICE guidelines are massively reliant on looking at published evidence base. A published evidence base, as Jacqui knows because she's doing a psychology degree, is stuff in peer-reviewed journals. We've had some of them, but we haven't had enough yet to get NICE guidelines. And I would say we're probably between 5 and 20 years off being part of the NHS, not through lack of trying, but it just takes a long time. So that's the rub, really.
It protects the public because nothing's going to get accepted until it's been thoroughly tested and looked at. So we can understand that. So it will happen eventually, but we know that what we do works, and so as research happen, we'll get there.
It's an interesting dilemma because it does protect the public from things that don't work, but there's a middle ground where there's things you've tested that do work and there's things you've tested that don't work. But then you've got the big in the middle, which is where we sit, which is things have not been tested by that particular methodology. They have been tested with some trials that we've done, some outcome measures studies, but we haven't got the randomized controlled trial or a series of randomized controlled trials with significant results, which would then allow us to move on to the next phase. So there's a really clear difference between things that are tested and shown to be effective, things that are tested, shown not to be effective or possibly dangerous, and then things in the middle like us, which currently haven't had enough research to show do they fit into this category or that category. The suggestion is, and all the signs are, we fit into the good category, but reasonably they're cautious of going, well, we don't know yet what the long-term effects of the lightning presses is. It's moved a long way. When we first started working with ME, people went, ME is not curable. Now, us having worked, other people in the field having worked, people are starting to accept that people do recover from ME. And chronic fatigue and other issues that we work with as well, but that's been obviously an area we work with a huge amount, and hopefully it's something radically changed and this will move quicker than we're dreaming of at the moment, but it has been a very long process. So the lightning process costs money because you've got to pay for the practitioner's time. Does it cost a lot of money? That's the other question. Why is it so expensive? Sometimes we hear this. Why do they charge? And I think I'm sure you have an answer, but one of the things for me is the problem with the lightning process, the great thing about the lightning process is it's relatively rapid, which therefore means you have to pay for it in one shot. You have to buy the lightning process. If you compare that to the amount, let's say, again, you have, see my dog wandering in the background. If you have acupuncture, once a month or twice a month for 5 years, you add that up and you see what that comes to. Now, you're not paying it in one go, for sure, but you still are paying it. And for most people, acupuncture is great, but it doesn't tend to resolve a lot of the conditions, particularly chronic fatigue, ME, multiple sclerosis, anxiety, depressions, things that we see radical results with. But what are your takes on that? What that question of why is it such a large amount of money? And to put it in context, the lightning process, on average, I think in the UK is about £600 to see someone.
Yeah, it is about £600, and I think, ethically, looking after people, I'm also a psychotherapist, and so if I see clients individually, they pay me sort of £100-150 an hour depending on what I'm doing with them, and I will ethically say to some clients, you will save money. I don't want to take money off you doing 8 or 10 sessions when you can go and do the lightning process, which will actually cost you less money and you'll get the results faster. So it's relative. I don't find that price expensive in the way that if you break it down to seeing another practitioner individually over a course of 6, 8, 10 sessions, that's going to cost a lot more, but it doesn't seem as much because you're paying for it one session at a time.
Yeah.
And I think that also we care about people, we're looking after people. So the Lightning Process is an organisation. It's an organisation of practitioners that all belong to, a group that's I suppose the whole organisation is funded. So head office is there. There's a committee there. If someone does have a complaint, it will be taken seriously and it will be heard by the committee of experienced practitioners themselves. And the whole organisation is there to protect and look after clients. So it's not just one practitioner that's charging this money. All of that's going into the whole organisation, that's there to make sure that clients are getting well looked after and that it continues to develop as a program. Practitioners are supervised. We all have a supervisor. It doesn't matter what level you are, we all supervise each other, and we have to do a certain number of supervision hours every year. We also need to make sure that we're continuing our professional development. So I go on training, which I'll pay for. All of us will go on various amounts of training every year, which we pay for in order to keep our skills, current, and to make sure that we're, the top of our game and being the best coaches we can be. And so coming back to that professionalism, what you're paying for is that level of skill, dedication, training. I mean, a lot of us have spent 2 years training to do this at least. We do our diploma, then we do our masters, and then we go on and do the Lightning Process training. So that's a lot of money and time that we've given, most of us, because we've recovered from illness and we're passionate about giving back. But at the same time, we want to give something that is professional and people are looked after within that organisation. So it seems like a large amount of money, but actually I don't think it is in relation to what the customer, if you like, is getting, and all of the resources they get alongside the training, as well as the professionalism and expertise of the trainer.
I think also if you look at the number of hours as well, if you do the Lightning Process, you usually get at least half an hour to an hour and a half of coaching before the actual seminar. Then during the seminar itself, the 3 days, you get usually between 3.5 and 5 hours each day, so that's 15 hours there. Then you get 3 hours follow up, so that's another 3 hours. So you're looking at between 18 and 20 hours, and that's all paid for. So if you look at that, 18 to 20 hours, that's about just over 30 quid an hour, and that's quite tough to see a practitioner where you're only charging 30 quid an hour. So the problem is, because it's all happening within probably a month or so, that seems like a large outlay. But if you look at it as well, if I'm only actually costing it about £30 an hour, that's not unreasonable. So we do recognise that it's a large cost to make at one point in time. I don't think it's a large cost, particularly if it changes your life. And as a result, a lot of practitioners offer instalment options. They say, look, you can pay in this way. Many practitioners also say, every now and then or every 2 months we have a free space on a seminar. So these things are available because many of them have been in exactly that position where they had to scrape money together from friends and family, because they didn't have any cash. So we do understand that, and so we think about ways to help that to be. But the fundamental thing at the end of the day is we can't do it all for nothing, because then the whole thing wouldn't work. The organisation, much like a charity, although the Lightning Process isn't a charity, but like a charity, it takes energy, time, people's jobs, and wages to run it, and therefore we can provide a service. Like, for instance, today we're talking about stuff. This is something that we can afford to do because we're committed to making sure that this information gets out appropriately, and that's important. Okay, anything else you think we should talk about on this topic?
With in danger of going off topic a little bit, I think because we've touched on the training that practitioners do, another frequently asked question might be one that I get anyway. I'm not sure if other practitioners have experienced this. Is what's the difference between it's like doing psychology or doing psychotherapy or doing CBT or doing hypnotherapy or doing pacing or doing the Lightning Process. So what's the difference? Why should I come and do the Lightning Process if I've done CBT or if I've done pacing and it hasn't worked? What's different about the Lightning Process? And I think that one of the things as well that's interesting is as I've just described, as practitioners, we're very, very well trained and well supervised and very skilled at what we do. Whereas you can get, I suppose you could go to a hypnotherapist. This is one thing I do come across clients who've been to hypnotherapists and they've gone, or if it's hypnotherapy that didn't work for me, or you kind of get these practitioners out there who are working, who perhaps haven't done as in-depth a course, or aren't supervised, or aren't part of an organisation, and you get hypnotherapy, NLP, areas like that not as well regulated perhaps as something like osteopathy. Osteopathy is very well regulated. So how do you know as a client coming to something like the lightning process that you could argue falls into that unregulated section of clinicians? How does a client know that they're getting good care, they're getting a good practitioner, they're getting the level of care that they should? Say, for example, if they went for CBT, that would be with someone they would say is qualified in a particular area and supervised. So I think it's important to just really show that lightning process practitioners, we train for a long time, and it's an in-depth training, and everybody's personally trained by you. And you can't just, there's written exams, there's practical exams. You can't just decide, I'm going to be a lightning process practitioner and come for a couple of days training. It doesn't work like that. You have to pass your exams, you have to pass them at a certain level, you have to be at a certain level before you can be that practitioner. So and the difference is that, I think if you go off and do CBT, or if you do pacing, some people have success with that, but actually the success results with those particular methods of helping with ME don't actually get as good results as we do doing the lightning process with people. So interestingly, we probably have better results than what one might argue are more scientifically recognized treatments that are more well researched. And you could argue that because we haven't done a randomized controlled trial yet, we can't say that. But what we can say as practitioners is just working with clients is that most of them get success. So I suppose that might be worth mentioning, just talking about why clients might come do the lightning process versus doing something that's more recognised within the industry as being well monitored, or
Yeah, I think there's a couple of interesting points there. The first thing, when I designed the lightning process, I didn't know it was going to get as successful as it was. It was just an idea that I had that seemed to have a life of its own. And as soon as I recognised that people were really interested in learning it, initially there was only like 2 or 3 people, and then there was 10 people, and suddenly there was 20, 30, 40. It was like, hold on a minute, we're looking at something here. And having trained as an NLP practitioner and a hypnotherapist, I had seen how, and an osteopath as well, I'd seen how some of those professions that have no regulation at all do produce this thing where you get some people who just don't know what they're doing, but they've all got the same qualification. And as a client, you don't know where to go because they've all got the same letters after their name. So I was very keen to make sure that we didn't run into that, that we future-proofed it by going, we're going to have a register, you have to be on the register. If you want to be a lightning processor, you have to agree to this code of conduct, your training and your skill set needs to be this good, and if it isn't, then there will be consequences, and that you'll have to go in front of a committee and explain yourself, and with the possibility, and it's in the contracts that we have with people on the lightning process register, that they can be removed from the register if they're not doing what they should be doing. Because it's so important, particularly with a small profession. There's only 60 people in the world doing the lightning process in about 16 countries. With a small profession, we have to make sure everybody is, doing what they should be doing. With a large one as well, but particularly when you're starting up. So it is really, really important to make sure that when people see someone, they're getting the same thing. So you have the same slides that are locked, so people can't edit the slides. Everyone has the same presentation. It's in different languages, but it is the same presentation. The same information, the same notes, the same aftercare, so that as much as we can tell, wherever you go, you'll get the same results and the same approach delivered to you.
I know from my kind of own professional, standing as well, working as a psychotherapist and working in organisations, I'm not going to work for a company that doesn't put the client's welfare first and doesn't have all of those things in place. So I'm very confident and comfortable that clients' welfare is put first at Lightning Process. So yeah, so well done, Phil.
Okay, it's not been easy. Not, particularly when you have a group of people who are probably relatively alternative thinking, because they're going outside the mainstream to try and get everyone to do something that's quite structural, and it's not always been easy, but it is important. And then the other thing talked about was things like pacing and CBT and GET and how they differ from the Lightning Process. I think is an interesting question. Now, I'm not an expert on CBT, although I've read quite a lot of it. I'm not trained in it, and I know a bit about graded exercise therapy and pacing. But I would say they are very different from the Lightning Process. The main thing is with CBT, a lot of CBT, particularly around health issues, are about how to cope and manage with a health issue. The Lightning Process looks at how can we change and not have that issue at all. So it's a very different starting point. With CBT, a lot of it is about noticing what your thoughts are, becoming aware of them, of how you're thinking, how you're acting, how you're behaving. And the Lightning Process does look at a bit of that as well. But with the CBT, there's a lot of analysis about, really looking and engaging with a thought and thinking about it and writing it down and thinking about other thoughts, which in the Lightning Process we don't do at all. We're not interested in the thought. We're interested in how do you change the way your brain's working and change your physiology. And this is also the difference between pacing. So graded exercise therapy, which is used for ME and CFS particularly, the idea is you can't exercise enough. Well, you can't exercise enough, you have this much energy, and what they do is gradually they get you to do a bit more and a bit more. But obviously they're not really doing anything apart getting you to do more, and then when you do too much, you go back to starting here where you can manage. And the idea is you're slowly increasing it. But I remember seeing a consultation about it, and the patient was saying, okay, I get that, I'm having to exercise more, but how does that work? And they went, well, you just exercise more and then you can exercise more. And he was like, yeah, but I don't really understand, why can't I exercise more and how's this going to help? And they just said, well, the more you exercise, the more you'll be able to do. And that seems to be the mechanism behind it, as far as I can tell. The Lightning Process is very, very different. It says, currently you can only exercise this much. Exercising more is just going to stress your system, going to put more pressure on and load on a system that can't tolerate it, and so you will collapse, and that's what happens mostly. People who do GET improve and have to go back and start again. So instead what we say is, this is what you can currently do. What we want to do is work with the way your brain works, the way it affects your physiology, so your tolerance for exercise increases to here, and then you can do more. So we're looking at how do you change your physiology so it works better, so your muscles are coordinated better, so the blood flow to them is better, so your hormone systems are more in balance, so you're physiologically more able to do stuff like exercise. And then you'll be able to do more, and then at that point there is an effect of doing more exercise has a positive effect on your body, because you're moving. Hello, noisy dog. You're moving lots of tissues around and fluids, and stretching joints and moving muscles, and that will have a positive effect. But just relying on the power of exercise to make your exercise better is, for me, a really not very well thought through strategy for improving something as complex as the physiological problems that you get in ME and CFS. So those are my views on it.
It's not, LP is not based on positive thinking, or that idea of standing in a garden full of weeds saying there are no weeds. It's not true, there are weeds. It's addressing the fact that there are weeds, and we need to learn how we can get rid of the weeds so that we can then have a beautiful garden. So it's not just positive thinking. Some people also ask, is it positive thinking, or is it affirmations, or is it hypnosis? No, it's not. It's training. It's training in scientific evidence-based.
Yeah, it's not wish therapy, is it? It's not, if I hope this enough, it will happen. It's like, how do you actually physiologically shift your body into working in a different way so you can do what you want to do. But because we're not part of the mainstream, people assume that it's all magic unicorns and magic beans and stuff, but it's not. It is possible to have rational thought without being part of the NHS, amazingly. So that's what we're doing. Anything else you'd like to add to this intriguing discussion?
Yeah, no, I'm just thinking about a message I got this morning from a client who couldn't do any exercise at all, who recently got on a bike for the first time in 10 years and been cycling 20k a day. And that's the sort of thing that you don't really get with graded exercise therapy. You don't tend to go from, that much. But the point being that he's doing it in a way that he feels great. He can manage it. His body feels good. Everything feels good. So there's no payback, so to say.
So in I did lightning process last week. I had 2 people with chronic fatigue out of the 6. So they weren't massively represented as a client group, although we talked about it a lot today. One of them hadn't been able to do swimming for 5 years and did proper 20 lap swim. Another hadn't been able to walk for more than half an hour a day, and if she did, she'd probably have to be careful the next day for a year. And she went running and did 15 minutes running. Has done 15 minutes running every day for the last 7 days, again with absolutely no response. Now, in terms of graded exercise therapy, that would be they'd be throwing their hands up in the air going, no, you can't do that. Well, the thing is, you can do that as long as you change your physiology. You can't do it if you don't do anything to your, if your body's the same as it was when you have ME, then running is clearly going to cause you trouble. But if you can change your physiology so it gets back to normal, then you can do this stuff. And that's one of the core messages. It's not about pushing through your illness. That's crazy. That doesn't work. What you've got to do is shift the way your brain and body work so you can tolerate exercise, people, whatever it is that's been causing trouble. And as I say, we focused a lot on ME and chronic fatigue today. And we do see a lot of people with it, but the lightning process is very good for lots of other things as well. Cool. All right, Jacqui, thanks so much for your time. I'm sure we'll cover more things next time we speak.
Sure.
You take care. See you later.
Thanks. Bye, everyone.
Bye. And remember, guys, if you want to ask any questions, then please send them in to info@philparker.org. We'll be really happy to answer anything, and we'll try and make the best job of it that we can. I hope you found this useful. See you guys later. Bye.